Good afternoon to all of you. Yeah, Dr. Rajeshri is here, and she is going to show us some basic, histological pictures. And of course, in continuity, there will be some, pathology also. This is for the first year PGs, because she made them learn about the histology of lymph nodes. So we're not going into detail. This was already dealt with. So let us see how the PGs can identify the different structures, what she is asking them to. And let us learn mainly the microscopy here. Yeah, Rajesh, you can start.
So we'll just have the PowerPoint presentation. So this is about the lymph node histology and pathology, mainly for the first year postgraduates.
So she started sharing the screen. Now, whatever is shown there, you need to identify. This is actually to the level of undergraduates, you should say. A good first year student can identify all this.
So this is the. So here in the first slide, we have given a section of a what organ it is. Anyone? Lymph node. A section of a lymph node. We have labeled it as A, B, and C. Can you people just identify what is A, B, and C in the lymph node?
A is germinal center.
Louder. I don't think everybody can hear.
A is germinal center, and B is medullary sinus, and C is
Medulla.
and C is the primary follicle.
Okay.
What is there outside here?
Capsule.
Okay. And then can you just explain how was the lymph node architecture divided, or just give a brief using.
Lymph node architecture is mainly there is a capsule. There is a capsule. Below the capsule, there is a cortex, and below the cortex, there is a medulla. And in between the cortex and medulla is a paracortex. The cortex continues to the medulla in paracortex, and the cortex is divided into. The cortex has lymphoid follicles. The capsule is made of the connective tissue which divides the lymphoid follicles and continues as trabeculae up to the medulla. The lymphoid follicles are of two types, primary and secondary. Primary has no germinal center, and secondary has the active germinal center, where there are B cells which are actively proliferating.
What type of follicle is that?
It's a secondary follicle.
Why?
Because it has active germinal center. The lightly stained one is the germinal center. Outside is the mantle zone, which is having dense lymphocytic aggregates.
Okay.
And above the outer of the marginal zone towards the cortex is the marginal zone of the lymph node.
Next. What is there here in the lymph node? Why?
Elderly person.
What elderly person means?
If in the lymph node adipose tissue is present, it represents that the lymph node is of elderly person.
What is the meaning? What terminology you have to use there?
Aging of the lymph.
No, what terminology? Yesterday we discussed. I was asking, and Aparna answered, and she said also how will be the cut section.
Yellow in color. Cut section will be yellow in color.
You want to call it as fatty infiltration, fatty replacement?
Fatty
So within
replacement.
this, before we complete this, you have to tell me. Next.
Second slide. We have to identify what type of cells you are seeing in this, and also what structure you are seeing in this particular picture, and relate it to diseases of a lymph node, where you can elaborately see those cells.
In first image.
Samiksha.
In first image, there is excess of eosinophilic infiltrate. And in second image, there is eosinophilic abscess, micro abscess.
Okay.
And it is seen in Kimura's disease.
So you want to end there. You want to say if eosinophils are same in the lymph node, it is Kimura's disease. What was the question? She said where you can relate it to. Because you have told only one point. No? You said eosinophilic infiltration, eosinophils. Is it the only criteria to make a diagnosis of Kimura's disease? Now, what are the conditions where so many eosinophils are seen in the lymph node? List at least 3 or 4 conditions.
Hodgkin's lymphoma, parasitic infestation like filariasis, angiolymphatic hyperplasia.
Angiolymphatic hyperplasia. There is no eosinophil there. What did Meenakshi teach you? Particularly, she told about one condition in the morning. I can remember.
We teach to UGs also.
Lytic lesions in the bone, eosinophils, then diabetes insipidus. 1, 2, 3, right? X.
LCH, Langerhans histiocytosis.
Write down, yeah, don't forget. It is not even few hours since she taught. Don't have that blank face. You should remember youngsters, young brain, how it should be. So you have to list causes of eosinophilia, eosinophils infiltrating the lymph node, all the conditions. Next.
Okay, these are 2 different pictures. So in this first picture, what are you seeing? Any one of you can tell me?
Louder.
What has happened to the follicle? What is surrounding the follicle? Yeah.
String
Pearl
of
shape.
beads, appearance of the mantle zone of the follicle, seen in Castleman's disease.
What has happened to the center of the follicle? This is the atretic follicle and it is surrounded by mantle zone. Yeah, mantle zone of lymphocytes. So where do you see this kind of change?
Variant of Castleman's.
Hyaline vascular variant of Castleman's disease. You can see a high endothelial venule here.
Yeah, still, that will show better appearance with, typical lollipop. Not very typical here. Yes.
So this is a slide of Castleman's disease. In this picture, anyone can identify what is the marked cell?
Body macrophages with apoptosis.
Yeah, describe a tangible body macrophage.
It is having abundant cytoplasm with medium to large nuclei with vesicular chromatids, and the tangible body macrophage has a clear cytoplasm and contain apoptotic bodies, which gives node a starry sky appearance.
So where do we typically see starry sky appearance? Yes.
Where are these tangible body macrophages present? What is the location of these tangible body macrophages? Particularly what part of lymph node? When we tell reactive lymph node,
Germinal center.
germinal center will be having all the maturation of lymphocytes, all the stages of maturation of lymphocytes, centrocyte, centroblast, immunoblast, and tangible body macrophages, plasma cells.
What is emperipolysis? Write down and then tell me before we end. Emperipolysis, hemophagocytosis.
So we'll go to the next slide. Can you explain me what is going on in this lymph node?
There's necrosis with cardiac debris, no? Inflammatory without neutrophils, suggestive of Kikuchi's disease.
So necrotizing lymphadenitis. You're saying necrosis in the lymph node. You describe the necrosis as necrosis with?
With cardiac debris.
Then what else is important?
There is no neutrophils present in the inflammation.
What else? What else is important whenever we see necrosis? Tell me a common disease of the lymph node associated with necrosis. Common disease of the lymph node with necrosis, where we see necrosis. So how do you make a diagnosis of tuberculosis there? What are the type of cells that are there in the necrotic surrounding the necrosis? Epithelioid cells, yeah. So this is it with epithelioid cells or without epithelioid cells here? So no granulomas here. Yes. Anything you want to add?
So in this case, we have to discuss about different causes for necrotizing lymphadenitis. We've discussed many a times. First, most common being the tuberculosis. We know how tuberculosis presents. Then coming to the next slide. So this was a Kikuchi disease, where characteristically there will be necrosis and cardiac debris. Neutrophil will be conspicuously absent. That is the most important point we have to remember.
Yeah. So look at this. This was a case report by Laza CO et al. A rare case of Kikuchi-Fujimoto disease, histiocytic necrotizing lymphadenitis. Okay. So they have very nicely given an illustration of this necrosis in lymph node. That's why we have taken it. You can zoom, I think. You put it in PPT? Oh, then you cannot. Okay. See, read that. Kikuchi-Fujimoto disease by histiocytic necrotizing lymphadenitis. So first is proliferative. Rajeshri can read.
Proliferative, there are three phases in Kikuchi's disease: proliferative, necrotizing, and xanthomatous. So first in proliferative, we have paracortex expansion, increased histiocytes and plasmacytoid dendritic cells, karyorectic debris, nuclear debris. Next, coming to the second one, that is necrotizing, same as the proliferative phase, plus necrosis of any degree can be present. Then it is at the last phase, there is a xanthomatous reaction, that is foamy histiocytes predominate throughout the necrosis. So these are the three stages of Kikuchi's we can identify.
Yeah, so necrotizing phase shows extensive necrosis with distorted lymph node. The picture which Rajeshri showed was only a part of the lymph node. Yes. So last phase is what? So what do we see if it is xanthomatous? Foamy cells, yeah, with the resolution of necrosis. Yeah, you have to read this so that you will know about the immunohistochemical staining of these cells.
The next slide. Can identify the marked cell? Plasma cell. And if I tell this is a lymph node and the plasma cell, can you correlate those things and come to the diagnosis?
Plasma cell variant of Castleman's disease.
Okay, plasma cell variant of Castleman's disease. So what is the difference between plasma cell variant and the hyaline vascular variant of Castleman's disease?
I mean, hyaline vascular variant of Castleman disease, there will be atretic follicles. In plasma cell variant, the follicles are hyperplastic, and in plasma cell variant, there we mainly see the plasma cells. And
where are these plasma cells seen?
Interfollicular.
Interfollicular areas.
Describe the morphology of a plasma cell.
Clock-faced nuclei, which is towards the periphery, and eosinophilic.
First, see, whenever you describe a cell, you should say cell, how it is, what is the shape, then the nucleus, where is it located. Okay, it's not just picking a cherry on the cake. No, how is the cake? What cake is it? So then, yeah.
It is a round to oval cell having a eccentrically placed nucleus and the eosinophilic cytoplasm. Or the nucleus also known as clock face type
What is the meaning of that?
It's a type of chromatin.
So the nuclear chromatin is coarse and it is arranged like that. The peripheral condensation is clock face or watch dial. If it is cartwheel, have you seen cartwheel? How will the cartwheel, write a cartwheel? So that is from the center, it goes, okay, that's how then what else?
And perinuclear of.
What is that perinuclear hub called as? What does that represent, the perinuclear hub? Golgi. Yeah.
Can one of you describe it, what it is?
This staining is very light in the picture. The
Picture
slide
has
was
come
good, but this is, thyroid. Rajeshri was seeing. So what do you see there? What is she showing there?
Reactive germination sector of the
Reactive. First call it what it is.
lymphoid follicle.
It is a lymphoid follicle with
Reactive germination.
Yeah. So what are the conditions where you see lymphoid follicles in the thyroid?
Lymphocytic thyroiditis and multinodular goiter.
Hashimoto's.
Hashimoto's, at least a few. Yes.